We have seen earlier what are the problems which are associated to what we call as a hepatitis, what are various reasons. So we shall see one of the problem which is associated and what are the reasons for it and how we can go for the treatment, what are the consequences. It is one of the most dangerous, deadliest disease apart from cancer, cardiovascular problems, brain stroke problem, kidney failure. This is also one of the such type of problem which can be fatal and quite severe type. So what it is a chronic disease in which has been diffuse destruction and fibrotic regeneration. I hope I told you what is fibrosis. I told you to see injury last time. So this is fibrotic regeneration of hepatocyte cells. As a necrotic tissue is replaced by fibrotic tissue, normal liver structure and the vasculature is altered. That impairs the blood and lymph flow. For that again, those who have got very good revision of liver anatomy, physiology, then they will be able to understand it. I told you about injury and repair mechanism, and when it is not a normal tissue or whenever it is scar tissue, I gave you the analogy of particularly cardiac problem, that is hypertrophy or dilatation. So similarly again here the same thing is there, and that results into hepatic insufficiency and portal hypertension. Now because of this, what happens, we shall see one after another. So it is a cirrhosis of liver is a chronic progressive disease which is characterized by widespread fibrosis, that is scar tissue or scarring and nodule formation. The development of cirrhosis and insidious prolonged course, usually after decades of chronic liver disease. Initially it is not understood, it is initially they cannot understand it, slowly gradually it happens, and then if you remember we have seen this word fulminant, that is very widespread problem is there, and then it is there. It is a consequence of chronic liver disease characterized by replacement of liver tissue by fibrous tissue, scar tissue and regenerative nodules, that leading to loss of liver function. So this is a normal liver, and whenever there is a cirrhosis, you can see these fatty cells are getting deposited. This is very initial structure, but later when we find, you can see this is a normal structure, very clear structure, and this is the cirrhotic liver which has got, see these are the scar tissue or fibrous tissue which has formed. So this is normal liver and this is a fibrotic liver or cirrhosis liver. So these things happen and this causes problem. It is 8th leading cause of death in United States. Even in India it is one of the major cause, and the patient which are having this viral hepatitis, around 20% with hepatitis C virus and hepatitis B virus, they are having development of cirrhosis. So there are various classes. One is alcoholic, then post-necrotic, that is necrosis which has happened, injury is there, biliary, cardiac, and the reasons can be many, as we have seen. Alcohol can be one of the reasons, drugs can be reason, various chemicals, toxicants can be reasons. Then as I told you, various infections can be there. So there are various reasons for this hepatitis. So let us see first one, that is alcoholic cirrhosis, is also called as a Lannx cirrhosis. It is macronodal portal cirrhosis. Men are likely to have alcoholic cirrhosis. Fibrosis occur mainly around central veins and portal areas. It is associated with the chronic alcohol abuse. Small nodules form as a result of some offending agents. This another type is known as a post-necrotic cirrhosis, that is macronodular cirrhosis. It is a toxin-induced cirrhosis. It is most common worldwide form. The broad bands of scar tissues are there. It is caused by post-acute viral hepatitis B, hepatitis C virus. Some industrial chemicals can cause it. It is more common in women. Then next is the biliary cirrhosis. I told you, if you remember, that when the biliary obstruction is there, the product is accumulated in liver, and because of that the damage starts. So the scar appears around the bile ducts and the lobes of the liver. It results from the chronic biliary injury. and obstruction of intrahepatic or extrahepatic biliary system. Primary biliary cirrhosis and primary sclerosing cholangitis are the biliary causes of the cirrhosis. Cardiac cirrhosis is a rare, it is a chronic liver disease associated with the long-term severe right side heart failure, and because of the heart failure there is a blood pooling. It is caused by AV valve diseases, and therefore there is a constrictive pericarditis, and as I told you, the chances are rare because right side heart failure are comparatively less. So what are the basic causes? Chronic alcohol abuse, chronic viral hepatitis, that is hepatitis B, hepatitis C, non-alcoholic fatty liver diseases. These are three major causes which are resulting into cirrhosis. Let us see the mechanism. I told you earlier, same thing it is there if you remember alcohol chapter where you studied in CNS. That is, when there is a chronic ethanol consumption, it causes release of certain cytokines, chemokines, then STAT pathway, then it causes regeneration, and this regeneration is fibrous tissue. Then gut permeability is there, then lipopolysaccharides are there, and the Kupffer cells are there inside the liver. They are important, they are doing the phagocytosis. The NF-kappa B and TNF alpha, these are the important cytokines, they are resulting, they causes inflammation. There are antioxidants are present, but because of one or other reasons this antioxidants are not sufficient, then they will cause or this oxidative stress, which is particularly caused because of the alcohol, will be there. These all causes mitochondrial damage, and this TNF alpha plays a role in apoptosis. Mitochondrial damage also plays a role in apoptosis, and the alcohol which is converted to acetaldehyde, which causes oxidative stress, that causes lipid peroxidation, and that results into apoptosis. So these are the major reason which causes apoptosis. Because of apoptosis, the cells are died, cells are rather killed, and no new that cells are there, the parenchymal cells are not regenerated, therefore the collagen synthesis takes place, and because of that the new fibrous tissue is formed which has no function. So these are the reasons for that. As I told you, oxidative stress, lipid peroxidation they are causing, and there are various reasons for that. As I told you, that is, and therefore there is a increase in the lipogenesis, decrease in the fatty acid oxidation, and therefore it causes a fatty liver. There is a hepatocyte injury and liver fibrosis. So these are the basic hallmarks, or these are basic reasons behind the problems. Then another is a chronic viral hepatitis. We shall see some of the features later as a comparative features of hepatitis, but we shall see basically how cirrhosis takes place. So viral hepatitis, it can be either acute hepatitis and its resolution, or chronic hepatitis. If acute hepatitis is there, either it can be having a resolution, that is correction, or it causes further damage and results into more damage and consequently death, or it is a chronic hepatitis, gradually it causes injury. There can be mild to moderate disease or severe disease like cirrhosis. Then because of cirrhosis there can be complication of portal hypertension and hepatocellular carcinoma. In that conditions, if both increases, then it causes death. The only solution when it increases too much is a liver transplantation, and it is not that easy. Even very big personality, if somebody knows Mr. Vilasrao Deshmukh, the former Chief Minister of Maharashtra and Central Minister, he died, and he tried to get the liver transplanted, but it cannot be done. So it is not that easy, but yes, that is one of the way, one of the solution. Non-alcoholic fatty liver diseases, that is healthy liver is there, and slowly there is a non-alcoholic fatty liver disease is there. There is a reversible type of condition is there. Up to certain extent it can be reversed, but it gets converted into the non-alcoholic steatohepatitis. Steato means fats, okay, and they are deposited, more fats are there, and later it is converted into cirrhosis, which is once it is cirrhosis, it is irreversible, because so many nodules of fat or fibrous tissue are formed, and these are not easy to get replaced. So what are the reasons for that? Simple steatosis is there, that is either obesity and these problems are there, which causes what we can say, accumulation of more fatty fatty acid molecules into liver cells, and from that this causes adipose tissue inflammation. And this gut microbial floras are there, they are having its role into that. These fatty acids are very much prone for oxidative stress, and once there is oxidative stress, that causes hepatocytes apoptosis, hepatocyte inflammation, and then the injury of these hepatocytes are there, and slowly that is converted into fibrosis, cirrhosis. So this is what the problem is. What are other causes? Primary biliary cirrhosis, I told you about what, that when there is a biliary obstruction is there. Why biliary obstruction? Too much thick solutions are there, and it forms gallstone, what we call it as a, or what we can say, colics are there. Then primary sclerosing cholangitis, that is inflammation of this ducts, that is particularly biliary ducts. Biliary atresia is death or what we can say, tissue damage. Cystic fibrosis is one of the genetic disease. Hemochromatosis, Wilson disease, Budd-Chiari syndrome, these are various reasons which results for this. Then other things are, that is galactosemia or glycogen storage disease, autoimmune hepatitis, medications like methotrexate, acetaminophen. Then Alagille syndrome, infection like syphilis, amyloidosis, this is again one of the infections. So these are a variety of causes, they are causing fatty liver diseases. So stages are how we make them, how we categorize these stages. One is healthy liver, we know, then slowly it becomes fat. So deposition of fat or fatty acids, they causes liver enlargement. Then whenever this it is accumulated, as we have seen earlier, there is oxidative stress. Because of oxidative stress, it causes injury. There is a lipid peroxidation that causes further injury, and when this no sufficient new cells can be formed, the scar tissue is formed to what we call as a liver fibrosis. Up to certain extent it's fine. So scar tissue is formed, more liver cell injury occur, because you can imagine the tissue is formed but it is not functional. Okay, just like suppose to whole your class we assign some work, and then I can find that suppose we give some assignments, and only few people are doing it and others are not doing it. Then what happens is, and suppose fortunately we are not making it compulsory, but then once it becomes compulsion, that this much topic, this much things you have to make it as assignments, then what will happen? Then the burden will be there only on those who are working, because others are enjoying. Similarly here the fibrosis is there, fibers are not having any functional role, they are as idle as the students who are idle despite all instructions. So this fibrosis, they are something like scar tissues, isn't it? So this fibrosis is there, these scar tissues are there, they are not functioning, so burden comes on the parenchymal cells. Because of that their workload increases, because of that more fats come to them, and because of that more injury can occur, and gradually one by one, है ना, वो बाकी के स्टूडेंट नहीं करते, इसलिए जो करने वाले स्टूडेंट है वो भी असाइनमेंट नहीं करते, समथिंग सिमिलर लाइक दैट, and then it is converted into cirrhosis, and the scar tissue makes liver hard and unable to work properly. So this is what stages are there. Now how we measure it and how we have the gradation? So early manifestation, the onset is insidious, early symptom is fatigue, we may not able to understand it properly. Later manifestation, they are severe and result from liver failure and portal hypertension. So jaundice, ascites, peripheral edema, they are developing gradually, and other late symptoms like skin lesions, hematological disorders, endocrine disturbances, peripheral neuropathies, these all are there, they are found. Then systemic clinical manifestations can be seen, neurological. If you remember, I told you earlier, that is called, we call it as a because of the accumulation of ammonia that occurs, that is the inflammations that takes place in the brain. So therefore it gives the neurological symptoms. Gastrointestinal upset because the digestive activities will not be done. Reproductive because it will affect various important steroid formation. Skin will be affected. Hematological because anemia, then blood clotting factors, everything are made by liver. Metabolisms of carbohydrate, fat, etc., and consequently cardiovascular. So because of that, so many simultaneously manifestations will be there, and therefore it becomes difficult to save the people once they go into higher stages. So hepatic encephalopathy, I told you, because of ammonia. Peripheral encephalopathy and asterixis is there. What is asterixis? It is a liver flap or flapping tremor. So the person will have this kind of tremor when hands are held like that. So this particular flapping tremors are there, which is a non-rhythmic asymmetric lapse in the voluntary sustained posture of extremities, and this is because of the impaired inflow of joint and other afferent information to the brainstem. This is again, it is a neurological problem which is there. Gastrointestinal will be anorexia, dyspepsia, that is indigestion, nausea, vomiting. Change in the bowel habits means either diarrheas or constipations, and there will be abdominal pain. There will be gastritis, hematemesis, then fetor hepaticus, esophageal and gastric varices. These are very dangerous. Hemorrhoidal varices, these are there. We shall see what varices are in later course. Reproductives, particularly as I told you, hormone synthesis will be affected, therefore amenorrheas, testicular atrophies, gynecomastias, impotence with the loss of libidos, loss of axillary and pubic hair. In older women there can be vaginal bleeding. In skin there will be jaundice, then spider angioma, that is spider like inflammation of blood vessel can be seen. Palmar erythema, purpura, petechi, and caput medusae, these are various things. These are the purpuras, how it is there, that is blood spots, skin hemorrhages, purple spot due to low platelets, it will be there. This is the jaundice. These are the angiomas, that is spider, this one the spider like structure. These are the common with the people with alcoholic cirrhosis. It is enlarged blood vessel in the skin due to high estrogen level. Palmar erythema, you can see the reddening of the palms. Then this is how happening, large visible distended, this paraumbilical veins, veins are distended, so vein structure you can see very clearly due to severe portal hypertension. This is particularly ascites, because of that there is a very big belly can be seen. Then hypokalemia, hyponatremia, hypoalbuminuria, these are there. Hematologically anemia, thrombocytopenia, leukopenia, coagulation disorder, splenomegaly. See, these are all related to functions of liver. You just see the function of liver, and you will find that whatsoever these all functions are reduced, and therefore there are difficulties. Cardiovascular fluid retention, peripheral edema, ascites. Now diagnostic we have already seen, history collection, liver enzymes, bilirubin, ultrasound, liver biopsy, these all things we have seen it earlier, because these are all diagnostic tool in all case of liver diseases we have to do. Complete blood count, electrolytes, esophago, gastroduodenoscopy known as upper endoscopy, CT scan, decrease cholesterol level due to abnormal fat metabolism, decrease albumin, increase in globulin, paracentesis to examine the ascitic fluid. This is a technique by which we can check the ascitic fluid for cell, protein, bacteria counts. prothrombin time so these are various things. So what are the complications of it? Compensated cirrhosis, that means patient have no complications, but decompensated means patient have one or more complications and they are difficult. The most problems, important problems are esophageal and gastric varices. We shall see what are these. Portal hypertension, ascites and peripheral edema, hepatic encephalopathy, spontaneous bacterial peritonitis, that is inflammation of peritoneum, coagulopathies, that is problems in the blood coagulation, hepatorenal syndrome, that is consequently it will affect kidneys also, so both will be damaged, and hepatocellular carcinoma. So these are various problems. You know what is portal vein? It delivers blood from the intestine to the liver. Due to cirrhosis there is increased resistance because this portal, this fibrous tissue, it will be obstructing it, so there is increase in the resistance, and because of that there will be hypertension. Normal portal venous pressure is 5 to 10 millimeter of mercury, but the pressure increases, and because of that collateral vessels to develop in the lower esophagus. So because of that, this in esophagus the veins are developed, the anterior abdominal wall, rectum, peritoneal peritoneum, parietal peritoneum. In all cases this additional collateral vessel, collateral means the vessel which otherwise were short, they will be elongated and they will grow. Just like suppose at some places you obstruct the water and then it will find ways from other sides. So similarly when it is obstructed in liver, it will find like this. It is mainly characterized by splenomegaly, large collateral vein and ascites. Collateral circulation develops to reduce the high portal pressure. The ascites, splenomegaly, hemorrhoids, gastric and the esophageal varices, superficial abdominal veins, these are the immediate concerns. So we shall see what are these varices. Esophageal varices, they are complex of tortuous veins. Tortuous means which are very long but having this जिसको टेढ़े मेढ़े बोलते हैं ना, like that tortuous veins at the lower end of the esophagus which are enlarged and swollen as a result of portal hypertension. Gastric varices are located in the upper portion of the stomach. Large varices are more likely to bleed, and esophageal varices are responsible for 80% of the variceal hemorrhage. Bleeding of varices occur due to alcohol ingestion, erosion by gastric juices, increased abdominal pressure by coughing, sneezing, straining at a stool, nausea, vomiting, lifting heavy objects, and they may have melena and hematemesis. Hematemesis, that is vomiting will have blood. Massive hemorrhage is a medical emergency. Ascites and peripheral edema, they are the accumulation of serous fluid. Serous is one of the membrane is there, we call them as a serous membrane, and in this membrane fluid is filled. Example, in outside the lungs, outside the heart. So these are the various serous cavities are there, and in that these are fluid cavities which provides frictionless movement of this contraction relaxations, and they provide sort of insulation, sort of what we can say mechanical protection. So causes are increased flow of hepatic lymph, decreased serum colloidal oncotic pressure, and hyperaldosteronism, that is increase in the aldosterone secretion. Peripheral edema, they occur as ankle and presacral edema. Because of the edema, there is a decreased intravascular volume, which is later decreased to renal blood flow and glomerular filtration. Ascites are manifested by abdominal distension with weight gain, abdominal stria, that is striations are there, hypokalemia, dehydration, decrease in the urine output. Then next is hepatic encephalopathy. It is a neuropsychiatric manifestation of liver damage. Liver is not able to detoxify ammonia, byproduct of protein metabolism. So there is an increase in the ammonia in the level. This ammonia crosses blood-brain barrier and produces neurological toxic manifestation, including inflammation. So cirrhosis, that causes inflammation, bacterial translocation and vasoactive mediators. Then splanchnic and peripheral vasodilation, It causes hepatocyte dysfunction. There is increase in the ammonia. There are portosystemic shunting. Otherwise, portal and systemic shunts are separate. The portal blood is then converted and it goes to systemic after detoxification. But if the shunting is there, the same toxic blood will be circulated. So therefore, increase in the ammonia in the blood level. It will cause brain edema. Further, it is causing the increase in the permeability to blood-brain barrier because of the inflammation and vasoactive mediators. So it causes astrocyte swelling, that is again increase in the various neurotransmitters like glutamate and glycine, neurotransmitter and receptor alteration, that is increase in the GABA receptor, brain glucose metabolism will change, and that is resulting to hepatic encephalopathy. So it causes changes in the neurological and mental responsiveness, inappropriate behavior. There are sleep disturbances, lethargy, deep coma it can be there. And usually once patient go in coma, it's very difficult to revive the patient. Prognosis is very poor. Then disorientation, time, place and person. Asterisk 6 we have seen, that is tremors are there, apraxia, then fetor hepaticus. Other sign are hyperventilation, that is increase in the breathing, hypothermia, decrease in the body temperature, grimacing replace. Grimacing means just smiling like face the person will make, just like as if the person is smiling very nicely. This is called as a grimacing. The spontaneous bacterial peritonitis will be there. It is a bacterial infection of the ascites fluid, because ascitic fluid is there and that is not protected one. Because of the alteration in the immune function. Most found bacteria is gram negative, enteric pathogen like Escherichia coli. So there is a spontaneous bacterial peritonitis. Following that, there is portal hypertension, therefore bowel edema, bacterial migration from GI tract to this hepatic area. Example of these are which are otherwise non-pathogenic, like E. coli, Klebsiella, Enterobacteriaceae, Streptomyces viridans, etc. They will cause fever, chill, abdominal pain, and there will be WBC will be increasing. Then polymorphonuclear, that is neutrophils will be increasing, pH will be decreasing, and for that the treatment is third generation cephalosporin like ceftriaxone should be given. Then hepatorenal symptom, it can occur in the patient with a decompensated cirrhosis. There is a type of renal failure with advancing azotemia. Azotemia means the azo means nitrogen compounds, they will be increasing in that, or we call it as a BUN, blood urea nitrogen will be increasing, oliguria, and there is no structural abnormality of the kidneys. It can be reversed with the liver transplantation. So thus it makes hepatorenal symptom. And if there is a transplant, only transplant can save, otherwise these are various factors which are affecting portal hypertension. Then there is a splanchnic systemic vasodilation, and thus it will be affecting whole renin-angiotensin mechanism, renal constriction, which causes a decrease in the GFR, and the urine production will be decreased. Then these are very good site for the development of the carcinosis, particularly hepatitis C virus related are there, and they can cause cancers, particularly end stage cirrhosis with the hepatocellular carcinoma. They are, as the name indicates, they are the end stage, they are very difficult and deadlier. Now what are the management? Because we cannot reverse, we have seen it. Only thing is what we can do is to slow the progress of cirrhosis and prevent and treat any complication, give proper rest, give proper diet, very nutritious diet, minimize further deterioration of liver through the withdrawal of toxic substances, alcohol, drug, whatsoever affect liver should be withdrawn. Correction of the nutritional deficiency, already I told you, vitamin, nutritional supplement, high calorie and moderate to high protein diet. The ascites can be treated. For that low sodium diet is there, because sodium if it is there, along with sodium water will flow. If you reduce the sodium, then along with the water release will be decreased. That is based on the degree of ascites. Patient may be encouraged to limit sodium intake to 2 gram per day or even lesser. Albumin infusion may be used to help maintain adequate urine output. In diet, spironolactone that is aldosterone antagonist can use along with the loop diuretic furosemide for that. The paracentesis is a mechanism that is done for remove ascitic fluid or test the fluid for infection. It is done for the patient with impaired respiration or abdominal pain caused by severe ascites. It is a temporary measure, that is withdrawal of ascitic fluid from that. It is a surgical procedure that reinfuse ascitic fluid into the venous system because that much fluid is reduced. Because of the high complex, it is not used now because we have seen that it was prone to have infection. Now this infection will flow in the blood only, and that will be very dangerous. Treatment of esophageal and gastric varices. So these are again very important. The treatment is to prevent the bleeding and hemorrhages. The patient should avoid alcohol, aspirin, NSAIDs and toxicants what are there. Patient should have esophagogastroduodenoscopy, that is esophagus, stomach and duodenum. The endoscopy of this are there should be done for the varices. Non-selective beta blocker like propranolol, nadolol to reduce the incidence of hemorrhage. The direct therapy for bleeding varices may include the somatostatin analog, octreotide or vasopressin. Intravenous vasopressin is given along with the intravenous nitroglycerin. So these are the ways by which it can be treated. This is vasopressin is to contract this. Simultaneously you can imagine two things are given. Vasopressin is given to contract blood vessel, and then nitroglycerins are given to avoid too much vasoconstriction. So to maintain this very meticulous job, it is there, it has to be done. Then there is one technique that is called as endoscopic band ligation. Endoscopic varicose ligation or banding is performed by placing small rubber band around the base of the varices. So wherever these varices are there from which the fluid is being secreted, there the small rubber band will be placed around the varix. Varix is the enlarged vent through which the secretions are coming. So these secretions are then controlled because of that. Then other is a sclerotherapy. See, these are the varices, we can see these are red color one, and from that these are the openings of that, and from that it is coming out. So injection of the sclerosant solution into varices through an injection needle that is placed through an endoscope. So along with endoscope it is given, and exactly there the sclerosizing, which sclerosizing agent means which are damaging, which are destroying it. The cells will be destroyed, and thus the structure which are responsible for fluid formation, and that will not be there. Then another technique is the balloon tamponade. Balloon tamponade control the hemorrhage by mechanical compression of the varices. Just like if you remember, you have seen earlier in cardiovascular system, that is balloon angioplasty. So here also balloon is there, balloon is inflated, and because of that it will be compressed. It is used in the patient with acute esophageal or gastric variceal hemorrhage that cannot be controlled by initial endoscopy. So like that tubes are there, that is known as a Sengstaken Blackamoor tube, that will be there, that will be passed, and that will be this balloon will be inflated, and because of the inflation that will cause compression of that varices from which the bleeding is taking place. This is how this can be controlled. Then another way is known as a Minnesota tube, that is, this is also a esophageal balloon mechanism. So various ports are there, that is esophageal balloon port is there, esophageal aspiration port is there, gastric aspiration port is there. There are a variety of tubes are actually just like big cable, it is there, and accordingly different activities are done, and here you can see that it is inflated and these varices are compressed because of that. So this is how this is done. Other supportive measures during acute variceal bleeding, that includes administration of flesh frozen plasma, packaged RBCs and proton pump inhibitors. The most important treatments are lactulose rifaximin for the hepatic encephalopathy. Why? Because they causes lactulose is laxative agents, and that will cause the passing of stool along with pass this tool, the ammonia will be extracted out or excreted out, and because of that its blood concentration will be reduced. Rifaximin affects the ammonia production, and these are there, but again these are almost difficult situations they are having. Antibiotics are given to prevent bacterial infection. We have seen third generation cephalosporin just below that. Transjugular intrahepatic protosystemic shunts, that is called as a TIPS. That is, it is a non-surgical procedure in which a tract, that is shunt. Shunt means two different tracts are there, they are connected together, that is called as a shunt. So there is a shunt between or systemic and portal venous system is created to redirect the portal blood flow, so that it will come lesser will be there, will be flowing down, or it will be released from that. It reduces the portal venous pressure and decompresses the varices, and thus it can control bleeding. It is contraindicated in the patient with the severe hepatic encephalopathy, hepatocellular carcinoma, severe hepatorenal syndrome, portal venous thrombosis. Why? Because the condition is so worse that body will not able to cope up with the all surgical complications, and therefore it will be very difficult. So like that, these are there. This is the portal one, this is the hepatic vein, and thus the this stent graft is put into this, so that from one area to other area, from portal vein to hepatic vein, the shunt will be there, and accordingly it will be working. Surgical shunting, that is portosystemic shunts, they are various type of surgical shunting procedures may be used to decrease the portal hypertension by diverting some of the portal blood flow. Currently surgical shunts most commonly used are the porta-caval shunts and distal splenorenal shunts, they are used. Then what is the porta-caval shunt? It is the portal one is anastomose. Anastomose are, if you remember, we have used one word, that is collateral formation. So that is called as anastomosis. If you remember, if you want, you can go through the figures you will find in Tortora anatomy physiology what is anastomosis. So the vein is anastomosed to this vena cava, inferior vena cava, and it is diverting the blood from the portal vein to the systemic circulation. So this is how it is done. Distal splenorenal shunts, the splenic vein is anastomosed to the renal vein, that means connected or shunt is made. The spleen conducts blood from high pressure to esophageal, of the esophageal and gastric varices to the less pressure renal vein, it is there. The treatment for hepatic encephalopathy, goal is to reduce the ammonia formation. So lactulose traps ammonia in gut, I told you this, and due to laxative effect it expels ammonia from the colon. Just now I told you this. The antibiotic like rifaximin and neomycin sulfate may be given to patient who does not respond to lactulose. The constipation should be prevented in this patient because it causes still more accumulation of this. Antibiotic reduces bacterial flora, decrease formation of ammonia will be there. Controlling GI bleeding and removing the blood from GI tract to reduce protein in the intestine, because they are offering as a substrate or food for that. Liver transplantation is the only resort when there is a liver damage is gone to or gone beyond certain extent, and again it has got so many complications actually, to get the liver, to match the liver, what we can that is matching histocompatibility, we call it as it, and there are many such complications are there. It's not that easy, but yes, that is one of the way which is there. Nutritional therapy, high calorie with high carbohydrate, moderate to low levels of fat. Protein restriction is done in patients with severe hepatic encephalopathy only. This BCAA remains recommended to treat protein calorie malnutrition. Patient with ascites and edema, they are on a low sodium diet. Foods that are high in the sodium should be avoided. So there are variety of food which should be avoided, like non-vegetarian food, alcohol, and the food which is difficult to digest, or complicated food, or what we can call it as a fast foods are there, they should be avoided. The green leafy vegetable, fruits, they can be the best food which should be there. So choose lean protein like legume, avoid raw seafood. So these are various ways by which we can have normal or good dietary habits. So this is how we'll go for. Check other sign also, that is bleeding gums, purpura, we have seen the figure, hematuria, hematomesis, vital signs of shock, because too much fluid if it is lost in the varices and ascites, then the urine output has to be monitored, otherwise patient may go in shock. Protect the patient from physical injury from the falls or abrasion, because encephalopathy and all reasons they may be prone for falling. Instruct the patient to avoid vigorous nose blowing and straining without bowel movement, because from this varices the more blood and fluid will be coming out. Stool softeners are given to prevent straining because it can cause a rupture of varices. Imbalanced nutrition, less than body requirement related to anorexia, impaired liver function, diarrhea, decreased absorption of fat soluble vitamin. These are one of the complications. So it should provide ample protein to rebuild the tissue, but not enough protein to precipitate the hepatic encephalopathy, because if you remember, hepatic encephalopathy was because of the ammonia. Why ammonia? Because protein metabolism. So again it is a very tricky situation over here. If you give less protein, then it will affect tissue building, injury was there. If you give more protein, that will cause more building of ammonia. So that is very tricky. Expert dietitian should do it. The diet should be supply sufficient carbohydrate to maintain weight. If client has ascites, edema, sodium should be restricted, we have seen it. Small frequent meal is easier to anorexia. Then another problem is activity intolerance related to bed stress, fatigue, lack of energy, alter respiratory function secondary to ascites. In that cases, long-term planning should include counseling the client to rest frequently and to avoid unnecessarily fatigue. Risk of injury because of the hepatotoxins which are continued, alcohol, etc., they should be removed. They should not be there, or any such agent is there part of, example paracetamol should be removed. Any agent which is affecting liver should be removed. It should be very cautiously done. Administration of sedatives and opioids should be avoided. Ineffective protection related to alcohol abuse and inadequate nutrition are there. So monitor for the manifestations of the infections and administered antibiotics as needed. Antibiotic may be required to control intestinal flora that aggravate the encephalopathy. So this is what the cirrhosis, we have seen what are various measures, we have seen various complications of cirrhosis, we have seen various stages of cirrhosis, and only thing one can do during that is prevent it if somebody can diagnose it earlier, because we have seen that cirrhosis is a chronic disorder, and for this chronic disorder if one can take care early, that is the best. If not, then the recovery is very difficult and very expensive also. So this is what about liver cirrhosis. Then next time we will see various viral hepatitis, their comparison, and basic treatments. What happened on Wednesday? No class was there. You are not done practicals?
No, sir.
Okay, why so?
Sir, there was a holiday, so that's why.
Okay.
Yes, sir. Sir, can we go for the exams on Monday?
Let us see, actually many other activities are going on, but next week we can plan.
Okay, sir, fine.
Anytime, whenever time permits, we will try to do it.
Okay, sir.
One sessional we have finished, second sessional we have to go for.
Yes, sir.
Okay, we'll see.
Okay, sir.
You are getting everything, no difficulties so far?
No, sir.
Okay. So go through this book.